Nutrition. The body requires fuel to be able to provide energy for cellular metabolism and repair, organ function, growth, and body movement. The BMR, or basal metabolic rate, is the energy that's needed to maintain breathing, circulation, heart rate, and temperature. In other words, the life-sustaining activities. Various factors can affect the energy level that's required. For example, if you're ill, have poor health, women who are menstruating, age, gender, etc. The resting energy expenditure, or the REE, or resting metabolic rate, is the amount of energy that an individual needs to consume over a 24-hour period for the body to function normally while at rest. Again, different factors such as those that I mentioned and activities or pregnancy, lactation can also affect energy requirements. You need to be familiar with the different nutrients and how they affect the body and where you find them. Carbohydrates are the body's main source of energy. We can find those in milk, plant foods, and grains. Proteins are another source of energy, but they're also essential for building, maintaining, and repairing body tissue. We find proteins in things like meats, soybeans, legumes, and cheese. Fats are also very important to our health. They help with the digestion and energy metabolism, the production and regulation of steroid hormones. They help maintain nerve impulse transmission, memory storage, and tissue structure. We get fats from different sources. The saturated fatty acids come from whole milk, cream, cheese, egg yolk, and fatty meats such as beef, lamb, pork, and ham. Polyunsaturated fatty acids come from vegetable oils such as safflower, corn, cottonseed, soybean, sesame, sunflowers. We also get them from salad dressings that might be made from vegetable oils and fish such as salmon, tuna, and herring. Water is extremely important, and we get that from our liquid intake and foods that have a high water count. Vitamins are very important, and there's two main types of vitamins. We have the fat-soluble and the water-soluble. Fat-soluble vitamins are A, D, E, and K. The water-soluble vitamins are C and all of the B's. And then minerals, which are inorganic substances that are essential for normal metabolism. Digestion is the mechanical breakdown of food to its simplest form. Peristalsis is part of the digestive process. It's the wave-like muscular contractions of the GI tract. Absorption uses the process of active transport, passive diffusion, osmosis, and penocytosis. If you look at the table 44.1 in your book, it may help you understand this process a little better. Metabolism and storage of nutrients. Enzymes are catalysts that actually will speed up chemical reactions. Metabolic reactions include glycogenolysis, glycogenesis, and gluconeogenesis. As we are eliminating the food from our body, that food mass in liquefied form is called chyme. As feces moves towards the rectum, water is then absorbed into the mucosa. The longer the material stays in the large intestines, the firmer the feces will be. Feces will contain cellulose, indigestible substances, GI tract cells, digestive secretions, water, and microbes. We all need to be a little bit better about reading the labels on foods as we purchase foods. These labels contain a lot of facts that really make it are really very important in helping us to decide if it's something that will be healthy for us, unhealthy, etc. They indicate how much of a percentage of the daily value an item is in the food. The food guide pyramid has gone through some changes in recent years, and it's not the same as it was when I was growing up. They also include fats and oils and sweets in the diagram at this point, and they've also changed the amount of servings. You do need to be familiar with what is required in a healthy diet. You also need to be aware of the needs of various age groups and the culturally diverse to ensure that these populations receive the nutrients necessary to meet their needs. Each group has specific needs. For example, infants through school age. As infants grow, they need protein, vitamins, and minerals. Infants are generally breastfed or they may be on formula. Between 4 to 6 months, then infants are beginning to be introduced to solid foods. Toddlers, 1 to 3 years, eat up to 6 times a day, and they tend to eat small, frequent meals, but they soon become picky eaters. School-age children, those that are 6 to 12 years, often do not eat the required nutrients. They're prone to a diet that's really high in fat, sugar, and salt because of their fondness for fast foods and snacks. Moving on to adolescents, this group is really concerned with their body image. They're more prone to anorexia nervosa and bulimia nervosa. The main nutritional source for this group is carbohydrates, both simple and complex. Young and middle adults have a reduced need for nutrients as their growth period begins to come to an end. Obesity can become a problem due to decreased physical exercise, and for women, pregnancy and lactation can put additional demands on nutritional needs. Older adults have a decreased need for energy as their metabolic rate slows down. Money, health, and physical state can really influence the diet of the older adult. In your book, Table 44.2 has a lot of religious dietary restrictions. Some of the alternative food patterns, one that I think probably most of us are most familiar with, would be the vegetarian diet. They have a complementary use of high and low biological value proteins that are required for their health. Children that follow a vegetarian diet are really at an increased risk for protein and vitamin deficiencies. Many styles of the vegetarian diets are nutrient poor and they lack complete proteins. It's very important to encourage people who are on an alternative food diet to make sure that they become label readers and that they are getting all of the nutrients, the vitamins, the minerals, the fats, the proteins, the carbohydrates, etc., that they need to be able to remain healthy. This is just a chart that shows you some of the different types of vegetarians. They go from vegetarians that will include eggs but no meats, or those that don't include any type of animal or dairy product, etc. So it's really, there's a lot of variety just in and of vegetarianism. When you're doing a nutritional assessment, it's more than just taking a diet history. You have to do some screening. Realize that some prescription drugs, many over-the-counter drugs, and herbs and natural therapies can affect a client's nutritional state. Know food interactions and medication administration, especially between milk and citrus fruits or juices and alcohol. Again, look at Table 44.2. Anthropometry is a systematic measurement of the size and makeup of the body at specific body sites. I'm sure all of us have heard of the BMI or body mass index. This is evaluated during the assessment to help determine the need for dietary consultation. Excuse me, and you'll find that as you're doing your assessments that many of these assessments today are looking for the BMI. They give you some guidelines with height and weight. The person should weigh this certain amount, and if not, then they're considered obese, or they're considered to not have an adequate diet. But even though those aren't always really on the money, it gives us a baseline to work with to determine if there are some nutritional needs. Laboratory and biochemical tests that can help with the assessment process would be a CBC, albumin, transferrin, electrolytes, BUN, creatinine, glucose, cholesterol, triglycerides, and retinol. When you're looking at the dietary and health history, you need to know what the likes and dislikes are, what the allergies are. Maybe they're allergic to some foods. With the physical examination, you need to assess for dysphagia or mechanical issues. Do they have problems swallowing, or do they have dentures that don't fit appropriately? If they don't fit appropriately, then chances are they're not eating appropriately. This can cause difficulties for clients. Be aware of signs and symptoms of poor nutrition. Possible diagnoses for poor nutrition would be a risk for aspiration, diarrhea, deficient knowledge, imbalanced nutrition, less than body requirements or more than body requirements, feeding, self-care deficit, impaired swallowing. Realize again that the client and the client's family has to buy into the plan in order for the plan to be successful. If you're not providing foods or encouraging them to eat types of foods that they like, they're not going to be compliant. Always refer to facility policies and procedures prior to implementing any type of intervention, and that also includes with feeding and nutrition. Ill, debilitated, and recovering clients often have poor diets, and a lot of factors can contribute to a poor diet: socioeconomic, psychosocial, and environmental. When it comes time to advancing diets, we start off with NPO, or nothing by mouth, move up to a clear, a full liquid, a soft, a bland, a low sodium, and then there's also the ADA, or the diabetic diet. To promote an appetite, you need to look at the client once again. It takes care and planning. You need to take into account the client's preferences. Nurses are in a wonderful position to provide dietary education. And nurses have a lot of autonomy in the diets that are ordered for the clients, as long as they fall within particular parameters. A pleasant environment is going to help improve the client's appetite. It should be clean and free of odor. If it's odorous, I don't know about you guys, but the smells can really turn my stomach. Oral hygiene will help remove unpleasant tastes and help make the food taste better. Mealtime is often a social time, so company may be beneficial. Understand that a lot of medications can affect appetite. It can decrease the appetite, cause nausea or changes in the taste or mental status, or it can increase the appetite. And make sure that you provide for the client's comforting. Make sure that they've been toileted, or their pain is taken care of, or that they're in a comfortable position, and so on. When you assist with oral feedings, make sure that the client is able to feed themselves, that they can swallow, and that they're positioned appropriately. If they have visual difficulties, they may need assistance. You can help clients by telling them where the food is placed according to the face of a clock. For example, you've got peas at 3 o'clock, potatoes at 6 o'clock. Or consistently place the same types of food in the same place on the plate. Allow the client to help direct feeding. Respiratory clients may require a longer period of time to eat because they're taking so much effort to breathe that they just naturally slow down. Those clients that have difficulty swallowing, they may require speech therapy to consult to help determine their ability to swallow without aspiration. You start slowly with ice chips. They may require thickened fluids. You can encourage the client to tuck the chin down when swallowing. Make certain that swallowing is occurring and that food or liquid is not being pocketed in the cheek. Place food on the strong side of the mouth. That may assist with swallowing. Slow the rate of feeding down and decrease the size of the bites. And provide rest prior to feedings. And make sure that the client is sitting upright for feedings. For those clients who have had a stroke and are having difficulty making their hands work, sometimes large-handled adaptive utensils may make the difference in allowing that client to be able to feed themselves. Enteral tube feedings will deliver nutrients directly into the GI tract. Surgically placed tubes are preferred for feedings that are going to last for over 4 weeks. After any tube is placed for an enteral feeding, placement should be confirmed by X-ray. There's different types of formulas out there. There can be milk-based, blenderized, protein, glucose polymers or lipids, pre-digested nutrients, and specialty formulas. For example, there may be a formula, or there's formulas out there that if a client has respiratory issues, that this type of formula is designed for people with respiratory issues. Each one of these methods that is listed on your slide to administer enteral nutrition has specific indications, assessments, and precautions. But with most of them, you need to make sure that you keep the head of the bed elevated at least 30 degrees. Complications of enteral tube feedings would include aspiration. If there is a surgically placed tube, there would be the surgical risk, skin breakdown, diarrhea, constipation, abdominal cramping, and occlusion of the tube. Parenteral nutrition is a specialized form of nutritional support in which the nutrients are provided intravenously. It's administered to clients who are unable to digest or absorb enteral nutrition. It requires a central line, in other words, not a peripheral IV site. No other fluids can be administered in the same line with these parenteral nutritions. Placement of the line has to be confirmed by X-ray. Different complications can occur at the site with the tubing, with the infusion rate, with electrolyte imbalances. It's also a high sugar solution, so you have an increased risk of infection. Routine lab tests and regular blood glucose monitoring is usually required. And nurses need to provide continuous monitoring, assessments, and documentation. Daily weights, for example, are usually required in addition to vital signs every 4 hours. And then, of course, evaluation. You have to measure the effectiveness of the nutritional interventions and amend those interventions if necessary. Involve any other discipline as necessary for additional input to make sure this client is being adequately fed. Don't forget to review the boxes and the tables in your book because they do summarize really important information.